Hello and welcome to the communication PowerPoint. In this PowerPoint, we're basically going to talk a lot about communication, how important it is, the things we should be aware of when we're speaking to somebody, how to properly speak to somebody, um, and things along that nature. So we'll go ahead and get started. So with communication, it's really important to know. All right, so for communication, we have both verbal communication and nonverbal communication. A lot of us are aware of this verbal communication, but I'm going to go over it a little bit in more detail. The first thing is when we are communicating, it's important that we're speaking slowly enough that the person can understand us. We want to make sure that we are speaking clearly. We're using words that have the same meaning, not only to you, but to the resident or the patient. And we're communicating in a way that facilitates dignity and respect of that individual, of that patient. And lastly, with the verbal is our attitude. All right. I know everybody's had some type of experience where you're talking to somebody or you walk in to a store or some building, and immediately the way somebody talks to you and looks, it's a combination of both the verbal and nonverbal. You notice they have sort of a poor attitude or a bad attitude, and it sort of automatically gives you this bad vibe. Like, I don't know about this person. It makes you maybe feel uncomfortable, down, not happy. It's not a positive interaction by any means. So attitude is going to be a huge part of not only your day-to-day life and how you interact with others, but also your work life. Our nonverbal communication is where a lot of people have trouble. So eye contact is very important. That, once again, is a sign of respect. Body language. Now, this is so important. How you present yourself, the way that what your body is showing says a lot about what you're communicating. A lot of times people pick up more on your nonverbal communication than they do on your verbal communication. What do you look like when you're saying this as opposed to what are you saying? So your body language, not making sure it's closed off. So holding your hands folded over your chest. Sometimes it says closed communication. You don't care about what you're saying or what they're saying. So you want to have an open appearance, like you're willing and open to hear what they have to say. Your tone. So this is semi about your verbal communication, but it's more about how it's presented. I know personally, and I'm sure other people have had a conversation with somebody, and all of a sudden their tone changes. And you can tell something's wrong or what they're saying isn't matching their tone. And you sort of get this weird, confused message from them. They're saying this, but their tone's saying something else. So your tone is very important. Your facial expression, right? Are you making faces while they're saying something that shows maybe you don't agree with them, you do agree with them, different things like that. So being aware of your facial expressions while you're speaking and or listening. Any gestures you make. Some people talk with their hands a lot. Just being aware of the gestures you're making. And the use of touch. So the use of touch can a lot of times mean caring, comfort, but in some cultures, some religions, that can be a totally different message. It could be a sign of disrespect. So you just want to be aware and make sure everybody's comfortable as well. And we'll get into this use of touch and space here in just 1 minute. To continue on with that nonverbal piece of communication, because it can be so important, there's some things I wanted to talk to you about, all right? So the first one that I want to talk to you about is kinesics. That's the study of that nonverbal communication. The first thing we're going to talk about is a kinetic slip, and that's where verbal and your nonverbal communication messages do not match. Just like we talked about on the last slide, is your verbal says one thing, but your nonverbal says a totally different thing. So what you're saying doesn't match your body language, your facial expressions, and things of that nature, your tone. Another big part of nonverbal communication is our zones of comfort. Now, every single person's zone of comfort is completely different than the next. Some people need more space than others. So it's important to understand how close you are to a person and how that may affect their comfort level. So we're going to start with intimate space, all right? This means we're pretty close with it, 18 inches or closer. This makes a lot of people very uncomfortable. Some people may be comfortable in this, but being aware of our space is going to be important. As we move a little further on into personal space, that's 18 inches to 4 feet away, okay? That's what people consider personal space. Now, as we move further apart, where people start to generally feel a little bit more comfortable is when we enter social space and public space. So social space is typically anywhere from 4 feet to 12 feet away from that person, where they feel comfortable enough, especially with a stranger or in a social situation. Public space is 12 feet or more, where people tend to have that comfort level. So just understanding there's different zones of comfort involved. These are the 4 ones that we're talking about here, and every single person's level is going to be a little bit different than the next on where they feel comfortable. When it comes to communication, we have to talk a lot about our professional relationship as well. So what is it that we can and can't communicate, and how do we maintain this professional relationship with our patients? One, it's important that we always have that positive attitude. You're going to hear me talk about this a lot because I can't tell you how much a positive attitude, positive communication can really affect your day, the people around you, but most importantly, the people we're taking care of, our patients. That will give them the best experience, which in return makes your experience good as well. It's really important we always stay within our scope of practice. You only do what you've been trained to do. You do not do anything more than that. If you do not know how to do something, you need to get somebody else or get training on that, okay? We're staying within our scope of practice. We're going to make sure we keep all our patients and residents' information confidential, all right? We're following that HIPAA law, making sure we're not sharing any information with anybody except those we've been given permission to share it with by the patient. We're not going to discuss any of our personal problems, all right? We're keeping those to ourselves. We're listening to our residents, so that active listening I talked about. We're making sure we're calling residents by the appropriate name. Now, this means that we're calling them by their name or what they prefer to be called. We're not going to walk in, hi, honey, hi, sweetie, I'm here to draw your blood. No, we're calling them by their actual name, or if they have a preference to be called something, we can call them by that. We can never give or accept gifts, all right? It's always very generous to think of others and want to give them a gift. It's also very nice to be appreciated to the point where somebody feels like they want to give you a gift for the care that you've given them. It's very nice. However, it's important that we do not accept gifts. The biggest thing I can say about the gift portion is make sure you follow the policies at your facility. Every facility is a little bit different than the next, so make sure you're following your facility's policies on accepting and receiving gifts. We want to make sure we're always explaining care prior to providing it. So that means that we're letting them know what we're doing before we do it. This will help make the patient comfortable as well by knowing what's happening. Next, it's also important that we don't use profanity, okay? That's just not professional. So while we're at work, while we're with our patients, we want to make sure we're not using that profanity. So these are some of the things that you want to think about when it comes to maintaining a professional relationship. The next slide we're going to talk about is listening, which I know I've touched base a lot, but people usually do all right communicating. It's the listening aspect that people have an issue with. So when we talk about active listening, these are some of the things that I was mentioning. We're facing the person, all right? We're looking at them. We're having good eye contact, leaning towards the person. That doesn't mean we're hunched over and we're in their face, but we're showing that we're interested by leaning towards the person. We're responding to the person when appropriate, all right? And then paraphrasing or summarizing, sort of restating the person's message in your own words. It's an excellent way to show that you are listening. So these things are great ways to sort of have that active listening. So it's really important when it comes to communication that we're sort of thinking about this slide in general, how we're communicating both verbally and non-verbally, how we're listening to people, how we're having a good attitude, how we're responding and respecting patients, and how we're maintaining that professional relationship. So this slide to me is one of the most important PowerPoints actually, because everything starts with communication, and this is in communication between your coworkers, between your superiors or supervisors, but most importantly between our patients who we're interacting with daily, and they're always not going to be in the best situation. So, understanding that a lot of our patients, they're sick, they're in the hospital, they're in the nursing home, they're coming in the doctor's office. And I know when I'm my best version, or when I am sick, I am not the best version of myself. And most people are not. So anything we can do to, brighten their day, to understand, have that empathy, understand what they're going through, that communication piece starts this whole process. So it's important to make that a positive one and make sure we're communicating properly and clearly to our patients.